Unit 1. Introduction to Health and Illness. Health, Illness Continuum. Models of Health. Health. Who defines health as a state of complete physical, mental, social, and spiritual well-being, not merely the absence of disease or infirmity. Or, it is a positive state of being that includes physical fitness, mental or emotional stability, and social and spiritual ease. Illness. According to Susser, illness is a subjective state of the person who feels aware of not being well. Or, it is a state in which a person's physical, emotional, intellectual, social, or spiritual functioning is diminished or impaired. Wellness. It is defined as a subjective perception of ability, harmony, and vitality. Letty and Pepper 1993. Or, a state of optimal health or optimal functioning. Indications of good health. To perform the best of their ability. To adjust and adapt to varying situations. Feeling of well-being. Feeling of harmony and togetherness.
Models of health and illness.
The individual's state of health is one of continual change. He moves back and forth from health to illness and back to health again. His condition is rarely constant. He may wake up feeling great, develop a headache mid-morning, and feel fine again by noon. As health and illness are relative qualities existing in varying degrees, it is more accurate to consider health and illness in terms of a scale or continuum, rather than an absolute state. Travis's Illness-Wellness Continuum Model, 1972. The Illness-Wellness Continuum Model was first developed by Dr. John W. Travis in 1972, as a dynamic representation of health, emphasizing that health is not merely the absence of disease, but a continuously evolving process. The model illustrates a spectrum where premature death lies on one end, and high-level wellness lies on the other, with a neutral point in the center. Travis and Ryan, 2004. This model is often visualized as a horizontal continuum with arrows pointing in opposite directions, joined at the neutral point. Movement to the right of the neutral point indicates progression toward high-level wellness, and is achieved through awareness, education, growth. Movement to the left of the neutral point indicates progression toward premature death, and is marked by signs, symptoms, disability. Crucially, the direction in which a person is facing is considered more significant than their current position. A person facing toward wellness may still be experiencing illness but has a positive outlook, whereas one facing toward illness may not have symptoms yet but holds a negative or careless attitude about their health. Travis, 1972. Treatment Module vs. Wellness Paradigm. The treatment module, which includes interventions such as medications, surgery, or psychotherapy, can help bring an individual from a diseased state up to the neutral point on the continuum by eliminating or reducing symptoms. For example, a diabetic patient who takes medication to lower blood sugar but makes no other lifestyle changes only reaches the neutral point. In contrast, the wellness paradigm encourages individuals to move beyond the neutral point towards optimal health, through positive health behaviors, self-care, and preventive practices. It does not replace the treatment paradigm but works in harmony with it. A diabetic patient who not only adheres to medication but also adopts a healthy diet, exercises regularly, and practices stress reduction is using the wellness paradigm to reach high-level wellness. Travis and Ryan, 2004, Dunn, 1961.
To Health-Illness Continuum Model, Neumann 1990. Betty Neumann's Health-Illness Continuum Model conceptualized health as a dynamic and fluctuating state, positioning individuals along a continuum that ranges from optimal wellness to death. In this model, health is defined as the condition or degree of system stability and is viewed as a continuum from wellness to illness. When system needs are met, optimal wellness exists.
Neumann emphasizes that health is not merely the absence of illness but encompasses the harmony of various system components. The model suggests that an individual's health status is determined by the balance of energy within the system, When more energy is available than needed, the system moves toward wellness. Conversely, when more energy is required than available, the system moves toward illness and potential death. Furthermore, Newman identifies that stressors categorized as intrapersonal, interpersonal, or extrapersonal can disrupt system stability. The individual's response to these stressors, and the effectiveness of their lines of defense and resistance, determine their position on the health-illness continuum. 3. High-level wellness model, Halbert L. Dunn, 1961.
Halbert L. Dunn introduced the high-level wellness model in his seminal work High-Level Wellness, 1961, where he described wellness as an integrated method of functioning, which is oriented toward maximizing the potential of which the individual is capable. Dunn, 1961, B.4.
According to Dunn, high-level wellness is not simply the absence of disease, but a dynamic and ongoing process of growth toward the full use of one's physical, mental, and spiritual potential. This model emphasizes the balance and purposeful direction of an individual within their environment. It places individuals on a continuum between illness and optimal wellness, where each person actively engages in behaviors that promote personal development, self-awareness, and environmental harmony. The model encourages individuals to make conscious and informed choices, adapt healthfully to internal and external stressors, seek meaning and purpose in life. Wellness in Dunn's framework is considered a lifestyle-oriented process, promoting personal responsibility for health and striving for higher levels of functioning despite existing medical conditions. 4. Agent, Host, Environment Model, Level and Clark, 1965.
The agent-host environment model, developed by Levell and Clark in 1965, is a classic epidemiological model used to explain the interaction of various factors that influence health and disease. This triad model emphasizes that health status is not determined by a single factor but rather by the dynamic interaction between the agent, host, and environment.
Agent, any internal or external factor: biological, bacteria, viruses, chemical, toxins, allergens, physical, radiation, trauma, or nutritional that can lead to disease or injury. Host, the person or population at risk. Host characteristics such as age, genetic makeup, lifestyle, immunity, and pre-existing conditions influence susceptibility and response to the agent. Environment, all external factors that affect both the agent and the host, including physical, climate, sanitation, biological, population density, vectors, social, cultural beliefs, healthcare access, and economic factors. According to Levell and Clark, health is achieved when there is balance among the three components. Disruption in any one of these can lead to the development of disease. This model is also the foundation of preventive medicine, especially in understanding disease causation and public health planning. 5. Health Belief Model, Rosenstock, 1966. The Health Belief Model, HBM, was originally developed by Erwin M. Rosenstock in 1966 to explain and predict individual health-related behaviors. It focuses on the attitudes and beliefs of individuals and how these influence their engagement in health-promoting behaviors or compliance with medical treatments. The model is particularly useful in public health and nursing to understand why individuals may or may not take preventive health measures, such as screenings, vaccinations, or lifestyle modifications.
Core components of the health belief model.
Perceived susceptibility. The individual's belief about the likelihood of getting a disease or condition. Perceived severity, seriousness. The belief about the seriousness of contracting an illness or leaving it untreated, including physical and social consequences. Perceived threat. A combination of perceived susceptibility and severity, how much the person feels at risk and how seriously they view the potential outcome. Perceived benefits. The belief in the effectiveness of taking specific actions to reduce risk or seriousness of impact, example adopting healthy behaviors or following medical advice. Perceived barriers, additional key concept. The perceived obstacles, cost, fear, inconvenience, that may prevent an individual from taking actions. Cues to action. Internal or external prompts that trigger action, example health campaigns, advice from healthcare providers, symptoms. Self-efficacy, added later. Confidence in one's ability to take the recommended action. This model is widely used in nursing practice to guide health education, design behavior changes interventions, and promote adherence to treatment regimens. 6. Evolutionary-based model of health, Matarazzo and others, 1990s. The evolutionary-based model of health proposes that illness and death serve adaptive evolutionary functions by influencing behaviors that enhance individual and species survival. This model emphasizes how health and illness are not solely biomedical or psychological phenomena, but are also shaped by evolutionary pressures and environmental demands. The model conceptualizes health as an adaptive function. Individuals who align their behaviors with evolutionary survival strategies are more likely to experience positive health outcomes. Conversely, behaviors or lifestyles that deviate from evolutionary patterns, example sedentary habits, poor diet, chronic stress, can increase vulnerability to illness. Key elements of the evolutionary-based health model. Life events. Stressful or significant occurrences, example trauma, loss, major transitions, influence health by triggering adaptive or maladaptive responses. Lifestyle determinants. Day-to-day behavioral patterns, diet, physical activity, sleep, etc., that impact evolutionary fitness and long-term well-being. Evolutionary viability within social context. The ability to maintain health-promoting behaviors within societal or cultural environments that may support or hinder adaptation. Control perceptions. An individual's belief in their ability to control health outcomes significantly affects adaptive health behavior. Viability emotions. Emotions such as fear, guilt, and pride serve evolutionary functions in shaping responses to health-related behaviors and risks. Health outcomes. The culmination of evolutionary, behavioral, emotional, and social factors that determine the physical and mental health status of an individual. This model provides a holistic and evolutionary psychology-based framework for understanding human health and guides modern lifestyle interventions aimed at restoring evolutionary congruence, example promoting natural movement, social bonding, and nutrient-rich diets. 7. Health Promotion Model, Nola J. Pender, 1982.
The Health Promotion Model, HPM, developed by Nola J. Pender in 1982, is a complementary framework to health protection models. It is designed to increase an individual's level of well-being by encouraging engagement in health-promoting behaviors rather than simply preventing illness.
This model is grounded in social cognitive theory and nursing practice, and it explains why individuals choose to engage, or not engage, in health behaviors. It emphasizes the role of personal experiences, individual characteristics, and external influences in shaping health behaviors. Core components of the health promotion model. Identification of influencing factors. The model identifies individual characteristics, such as age, gender, socioeconomic status, and cultural background, and experiences, such as past behaviors, that influence the likelihood of adopting health-promoting behaviors. Behavior-specific cognitions and affect. It focuses on perceived benefits, barriers, and self-efficacy, as well as situational and interpersonal influences, which affect the individual's motivation to act. Organizing predictive patterns. The model helps organize these individual and contextual factors into patterns that explain and predict engagement in specific health behaviors, such as exercise, diet, or stress reduction. Explanation of motivations. The model explains why individuals participate in health-promoting activities often influenced by their beliefs, expected outcomes, and support systems. Ultimately, Pender's model encourages proactive involvement in one's own health and serves as a guide for nurses and healthcare providers to design personalized interventions that enhance well-being. 7. Holistic Health Model. The holistic health model is a comprehensive approach that emphasizes the interconnection of the mind, body, spirit, and environment in achieving optimal health. Rather than focusing solely on the treatment of disease, this model gives priority to health promotion, disease prevention, and the alleviation of suffering by recognizing the whole person within their physical, emotional, social, cultural, and environmental context. This model assumes that health is more than just the absence of illness, it is a dynamic balance of all aspects of life. It integrates conventional medical practices with complementary and alternative therapies, such as meditation, yoga, acupuncture, and nutritional counseling, to promote healing and wellness. Key components of the holistic health model include promotion of a sound mind and body, strong family and social relationships, healthy environment, recognition of cultural, spiritual, and emotional influences on health. Healthcare providers using this model encourage self-responsibility, client empowerment, and active participation in the healing process. It supports the belief that people can play a significant role in maintaining or regaining health by making conscious lifestyle choices. The holistic health model does not originate from a single individual like some other health models, example the health belief model by Rosenstock or the health promotion model by Pender. Instead, it is an evolving concept rooted in ancient healing traditions and later integrated into modern nursing and medical practice. However, in the context of nursing, this model was popularized and structured by Barbara Dossi. A leading figure in holistic nursing, Barbara Dossi is often credited with promoting and formalizing the holistic health model in nursing care. She emphasized the integration of mind, body, spirit, and the importance of caring for the whole person in her work, particularly in the book Dossi, B.M., 2016. Holistic Nursing, A Handbook for Practice, 7th ed. Jones and Bartlett Learning. This model has since become a cornerstone in holistic nursing practice, recognized by organizations such as the American Holistic Nurses Association, AHNA. So while there isn't a single inventor like in other models, Barbara Dossi is the key figure who framed and promoted it within professional healthcare, particularly nursing.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.